Are you feeling run down, a little depressed, tired of looking in the mirror with the bags under your eyes, your skin flaking off from the dryness, and the scale going the wrong way? Today, I'd like to talk to you about Hashimoto's disease, a condition that affects millions of people worldwide. It's the condition that is often misunderstood. And I believe that by discussing it today, we can help raise awareness and promote understanding of this important topic. In 1912, a Japanese physician, Dr. Hashimoto, stumbled across what we call now Hashimoto's disease. So what is Hashimoto's? Simply put, it's an autoimmune disorder that affects the thyroid gland. The gland is responsible for producing hormones that regulate the body's metabolism. And when it's under attack by the immune system, it can lead to a range of symptoms and health problems, resulting in inflammation and damage. The exact prevalence of Hashimoto's is not known, but is estimated to be one of the most common autoimmune diseases in the United States. According to the American Thyroid Association, about 14 million people in the US have some form of hypothyroidism, and the majority of cases are due to Hashimoto's disease. Although the disease is not fully understood, it is believed to be a combination of genetics and environmental factors, and each person may experience a different set of symptoms. The most common symptoms are fatigue and weakness, weight gain or difficulty losing weight, depression and anxiety, and elevated blood cholesterol levels. Some of the known factors for Hashimoto's, risk factors for Hashimoto's, include genetics. Hashimoto's tends to run in families. Gender, women are more likely to develop Hashimoto's disease than men. Hashimoto's can occur at any age, but it's most commonly diagnosed in middle-aged women. And if you have another autoimmune disease, for example, type 1 diabetes or rheumatoid arthritis, you are at an increased risk of developing Hashimoto's. Diagnosis of a Hashimoto's is typically made through a series of blood tests that measure the levels of your thyroid hormones and antibodies. To test for Hashimoto's, your healthcare provider may order the following tests: a TSH test. The TSH test measures the level of TSH produced by the pituitary gland. The TSH levels are usually elevated, indicating an underactive thyroid gland. Along with T4 and T3 test, also typically low, will result in Hashimoto's. The most important test, though, to diagnose Hashimoto's is the TPO test. When TPO levels are usually high, this can indicate an autoimmune response from your body. The most commonly prescribed synthetic thyroid hormone medication is Synthroid. Living with Hashimoto's disease can be challenging, but with proper treatment and management, most people with this condition can lead healthy, productive lives. So here are some of the tips with living Hashimoto's disease. Follow your treatment plan with your healthcare provider. Eat a healthy diet. It's important to include nutrient-dense foods, fruits, vegetables, whole grains, protein, and healthy fats. Manage your stress level. Maybe yoga, meditation, mindfulness. Aim for 7 to 8 hours of sleep per night, and consider creating a consistent sleep routine. And stay active. Regular exercise can help manage your symptoms. Also, advocate for yourself. It's important to advocate for yourself and communicate openly with your healthcare provider about any symptoms or concerns you might have. Living with Hashimoto's disease can be challenging, and it's important to acknowledge the emotional impact that a diagnosis can have. However, the right care and management, it is possible to lead a healthy and fulfilling life. Remember that everyone's experience with Hashimoto's disease is different, and it's important to work with your healthcare provider to develop a management plan that's tailored to your individual needs. In conclusion, Hashimoto's disease is an important topic that deserves greater attention and understanding. By raising awareness of this condition, we can help promote better healthcare outcomes for those that are affected. I encourage anyone who suspects that they have Hashimoto's to seek medical advice and get the support that you need. Thank you for listening. And now I'd like to introduce you to my audience. So if you guys will come up, this is Bernadette, this is Barb, and over here, this is Kayla. So thank you. And I hope you learned a lot from my speech.